board now, because so that I don't forget it, because we put this up on our Ventures in Community YouTube channel now. So we put the general meetings up for all of you to be able to go back to. So one of the things I want to mention this morning, welcome everybody. I see people are still popping in. I'm going to put in the chat as well, if you can rename yourself and put, so that your name is up clearly, and also what organization you're with. That way we don't have to go through many minutes of introduction. And then if you have announcements that don't need to, a lot of explanation, you can also put them in the chat. And when I record, we save the chat so that then we can send the chat to everybody, so you can all get announcements really easily. So I'm just going to put this into the chat. Pardon the typing. And then what I'm going to do here is I'm going to turn this over. Oh, I'm going to turn this over to Kate first to have a blessing, and then turn it over to Joe to kind of take us through today. So, Kate.
Yes, please join me in a moment of blessing and prayer. Blessed Spirit of life and love, fill our hearts and our minds and our bodies with your presence. Remind us of the holiness of our lives. Remind us of each precious moment. Remind us of the beauty and the gift and the act of giving and generosity and love ever expanding. Blessed Spirit of justice, remind us that our words and our deeds matter. In this community gathering, we are here to build a stronger world, a world of equity and justice and beauty for all, a world of liberation. Please bless us and guide us. Blessed be in all holiness. Amen.
Okay, so I'm going to turn over to Joe, the forward movement for today. Thank you, Kate, so much for your always deep blessings. So, Joe, off to you.
Okay, so today on the agenda, we've got the health department will be joining us. As you might expect, they're incredibly busy. When we had, in addition to communicating status and planning vaccines and reacting to positive tests and communicating plans to the community, these are the folks who are also kind of the responders when we have something that might occur at one of our sites. And so it's, Sharon Arndt and Dr. Ben Schwartz will be joining us to go through and discuss the pandemic in the Route 1 corridor with the plans for vaccination and touch on plans for equity and concerns about how to make sure the vaccine gets to kind of the hardest to reach or harder to reach communities in the corridor. They'll be joining us at 1. That we had to make that shift. Sorry, they'll be joining us at noon. I saw Bill go, ah! They had to shift it slightly from our original plan. So, but it's really great that they have the time to invest with us. I've heard Dr. Schwartz speak a number of times, and he does a great job of covering all the issues and translates in a way that I find very helpful. So given they'll be joining us at noon, we actually do have some time for some announcements, I think. Initially we thought we wanted to maximize the time with them and we wouldn't be able to do announcements, but maybe Bill, it is worth going around and doing announcements if folks have things that they want to communicate. I know there are many in the chat. Would it make sense?
Mm-hmm. We could do that. if you don't mind, I'll just start with something that I mentioned briefly earlier, and that is that Ventures in Community now has a YouTube channel in which we will be posting recordings of our general meetings and also any other things maybe that arise that we decide to record in the future. And also our Facebook page has been updated. Thank you so much, Christina. So we've got the right email and other things on there.
Diane Hill help with that, does that for,
Oh, Diane does. Okay.
I delegated it to.
Okay. Thank you. And we have to thank Joanne Masterson because she did a lot of running interference for us because there was
Holding.
a problem with it. info@venturesinCommunity.org email was not forwarding the last couple of months to Christina. And so we discovered what the problem was. And I unfortunately flooded her with forwarded emails that she said, please don't, they're coming in now. so we have some improved communication.
Okay.
Should we, Bill, should we also spend just a couple minutes on an update related to the work we've been doing around the new shelter? I know we had a really good joint VIC and South County Task Force meeting. Was that just Friday?
Yes, it was just this last Friday, wasn't it?
Right, and I think we recorded that, so that's available, should be available soon for anybody who didn't see it.
Yeah.
Mary might be able to update us on that.
Is Mary here? Oh, there she is.
Yes, yeah, we put it on our YouTube channel, I think, and I will send out the link to everyone, and we can, I don't know how we can get it on both YouTube channels, but we'll ask the tech wizards about that.
We could always just put a link and a pointer on ours to,
Yeah,
on our website to that.
or on the Facebook page or both.
Right, yes.
Yeah.
Yeah.
So
But as a follow-up, we did send some of the questions from the chat to Stork's office, and we thought we might have some other questions that we want to get clarified on a county Q&A page that anybody could access, because a lot of the questions come up over and over, and there are a lot of questions about the need for the housing that I think were explained well by the two Toms, Barnett and
Right.
Fleetwood, but it wouldn't hurt to have them questioned and explained again in the Q&A that people will have access to. So if we can, maybe we'll help figure out some questions and get those answered too and put up in the Q&A.
That's
I
great.
think that'll be very useful because there's a limit to how many times you want to answer the same question over and over again. And if we can have a quick way of doing that, it would be good.
Right. I thought the
I feel like
presentation
we
did
need we need
Go ahead, Vic.
uniform answers.
Yeah.
Yeah, we need to,
Yeah, not
well, we
everybody-
know the answers
I thought
because they, go ahead.
I thought the meeting did a great job of kind of grounding the need for this new shelter, the need for affordable housing, and the need for permanent supportive housing. We got a picture of the location and kind of a good overview. And then Pam talked to us about kind of a day in the shelter and what shelter life is really like. And then importantly, we had one current and one former resident of the Kennedy shelter speak to kind of, which really shows you how important these facilities are and how life-changing they can be. So I do, if you weren't able to join it, it is worth giving that a watch rather. And then several members of VIC are part of Supervisor Stork's committee, advisory committee around the new shelter. And that's kind of an ongoing activity as well. So I think that's a major focus of VIC currently, to just make sure that, we advocate for a much needed shelter. And now maybe we'll go to other announcements, unless anybody wants to add on the shelter.
Yeah, I just add one thing to that. I think it's going to be really important for VIC and South County Task Force to kind of help build public understanding of this shelter and why we need it and why we need it there. And I think, because I think the homeowners people, what I've heard is they're kind of building some opposition to it. I don't know what they're going to do, but they seem to be taking a survey of members. And I think we need to build awareness in our churches, in our faith communities, in our nonprofit organizations, so that if we need to present a big show of support to the supervisor, that we're ready to do that. Because these things often come down to the, big public hearings and public meetings. And if he doesn't have a show of support, it's going to be hard. He's for it. We don't have to convince him, but we do have to support the idea in the community.
May I say something?
Yes.
I think that one thing that we need to do, because when I sent out a notice about the meeting to the outreach committee at St. Luke's, so they all watched. And I got a response back from somebody who was very upset and excited and everything about, she said a lot of kids walk home along Beacon Hill Road. They walk from West Potomac back, cross Route 1 back to the apartments behind the shopping center there.
Mhm.
I don't have any information at all about that. And so I think it would be important to address that point. And she mentioned another school, another, pardon me? Oh yeah, right. Okay, so I think that's one thing we really do need to get statistics on. And
that's one that we really need a consistent answer on. Absolutely. Everybody's not going to be saying exactly the same thing on that topic. County, community, county, everybody. Because it's going to keep coming up.
Right.
And is it possible for somebody who is much more educated than I to offer a talking sheet from which we can all operate from to help counter some of the myths and the fears and anxiety?
I mean, I can work with the county to try to get them to pull something together from the probation and parole and like what the laws are and what's required.
Yes, and we can help distribute that, target the neighborhood as well, because that we have enough fear and anxiety these days.
Yeah, this is to piggyback on what Kate said. I was just sitting here and thinking about, excuse me, what information that we have that is accessible, that we would be able to share with our community and our churches and so forth about the shelter, and who can use the shelter, who do we cater to, or not to say cater to, but who's utilized in the shelter.
Yeah, I mean.
Also, another thing would be to understand if there's going to be some kind of, fencing or barrier. Is there going to be something that sort of sets the whole complex off, or is it going to be totally open? I mean, is it possible, to get some information like that?
I think that's exactly the kind of stuff that the task force should be focusing on.
Right.
What Stork's office keeps saying is it's not an issue of if it's going to be there, it's what's it going to be, what's it going to look like when it's there. And so I'm hoping, we should push that, I think.
Another real quick, back to West Potomac, the principal is a part of VIC. She doesn't always,
Oh, right.
she's not always able to be part of the meetings, but she keeps up with all the emails and things like that. So she, so she's a part of VIC, and several other people from the West Po community are involved with VIC.
Hmm.
Well, I think it'd be interesting to know how many students from West Potomac are actually walking there. I mean, I worked at Quanda Road, which is right beside there, and I don't ever remember seeing masses of students walking up that road. So I can't believe that they are not being bused across Route 1. That would be a safety issue for the school system. So I think checking with them to see exactly what the situation is on how those students get home would be interesting.
I agree.
Yeah, we might ask on the task force to have have some of the school people come to a meeting and address the issue of the schools and how far are they and where the kids walk. And,
Right.
if we did that, then we'd have a tape of it and we could show that to people who want to know.
Pam,
Yeah,
are there any instances of problems outside the existing shelter? I mean, yeah.
I mean, one of the things I've thought about is if you know this area of the current shelter, there was a big, relatively new apartment complex right across the street.
Right.
And we haven't had complaints, so I was hoping we could get them to make a statement or,
Yeah, that you're good
testify at some
neighbors.
point.
I mean, I think that would go a long way to relieve some fears, to know that there's no history of problems.
The biggest problem at Kennedy is getting across Route 1 and not getting hit by a car.
Yeah,
I mean, we've had people be killed
right.
in front of the shelter. But we do need to be prepared on the sex offender stuff, because it's going to come up, and we take sex offenders and we're not hiding that. So, and there's not screening before they come in, et cetera. So
And there are sex offenders in our neighborhoods as well,
exactly.
right, in our community.
Right.
Yeah.
The point is that we don't know that where are they? Yeah.
Well,
We know if they're on a map, you can look them up. And
you can look it up.
there's 10
Yes, but that is what I am saying is that you are not currently
Oh, yeah,
looking all the
yeah.
time where are
Right.
the sex offenders in our area. But there is maybe a pre-assumption that if you are homeless,
Right.
yes, that is all part
Right.
of the whole package. And,
Right,
and I
right.
wanted to ask a question. Maybe this is so silly, but that is already happening. Are the task force that is trying to understand how this shelter is going to be look like and where it's going to be, is talking with the neighborhood where it's going to be placed, or not yet? Because you mentioned, I don't know who mentioned that there is a survey going on in the neighborhood about.
The survey would be among the homeowner association members in all of northern Mount Vernon, but there's not been a concentrated discussion with the neighbors right around the area of the shelter.
For
But
whatever reason, Stork's office hasn't initiated that, and at some point it's going to have to happen. You're absolutely right, Maria. There are some couple neighbors on the task force. So
Okay.
that's at the
Because
moment.
I think it's going to be interesting to be able to explain, because if you are not familiar with how a homeless shelter is working,
Right.
you may have preconcepts
Mhm.
about what exactly it's going to look like, and nobody want to have trouble in their street.
Exactly.
Right.
So yeah, I think the education process is going to be huge
Really
in
important.
this.
Really important.
Yeah, and I thought, I mean, really, it is worth watching that meeting from Friday, if anyone hasn't seen it, just for that, right? For the discussion of how a shelter actually works. I thought, yeah.
Where is that meeting, Joey? Where we
It
can
was-
find that?
It was last Friday, and we're gonna send out a link to that. It's
Okay.
on the
Yeah.
South County
It's not
Task
here in the
Force.
chat, right?
It's on the South County Task Force YouTube channel. But
Okay.
Mary will let us know how to find that.
Yeah, if
Thank
Mary
you.
can put a link, that would be awesome, because I know I was out of the office on Friday.
Right.
Thank you.
I was going to say something else about. County also just this Friday, they're at the task force meeting, they're going to show a video of the new Baileys, shelter to give people not only what I said about how shelter functions, but what a new modern shelter looks like and has in it. So hopefully that will help as well.
And the contrast between the new Baileys and the old Baileys is unbelievable. You know, I mean, it really is a modern, bright building that people will want to stay in, as opposed to the old one, which didn't feel that way.
To say the least.
Yeah.
Look, I think any improvement in the Kennedy shelter will look like night and day.
Absolutely.
Well, I'll just add to that, I think it's not only that they want to stay there, but I think people would want that kind of shelter in their neighborhood.
Yes. Yes.
You know, that it's appealing in a way because it actually fits in very nicely.
Right. Yeah.
The one thing I didn't think the county did as well on Friday as they've done in the past is how much they really did look at other sites.
Yeah.
And that this was
Right.
not just, oh,
Right.
this is obvious. They went to a lot of effort. Pitch that better.
Yeah, I did ask them for their slideshows, but I didn't get them. I'll try again because I think if that slideshow went a little bit more slowly, you could see
Right.
more clearly where they looked.
Right.
Also, it hit me that they're talking about 6 years before this opens, which is really, 6 more years of Kennedy shelter is a long time.
Right.
Yep.
What do you think about that, Pam? Is that going to work?
I don't think we have a choice. It's gonna, I mean, Bailey's took a long time. I mean, yeah, it could move probably faster than 6 years. It really depends on how much we get pushback and how slow the approval process is. And then, I mean, construction at Bailey's took from April to a year, October later. So almost about a year and a half. So, and that's, that's without all the pre-planning and amendments to the zoning and all that jazz.
Mhm.
How is the relationship with Munlock House and their neighbors?
Perfect. They don't even know we're there.
Yeah.
I mean, my
Right.
favorite story is one that's really old now, but that somebody living in, I think it was Lafayette Apartments, said they wanted to donate to the homeless shelter, and where was it? And it was literally right next.
That's fantastic.
That's great.
That's one of my favorite old stories.
It's literally next door.
We should advertise that.
I just want to echo that I think it's really, really important to explain how hard the county worked to find a place, because many people were asking me, well, why does it have to be here? And it would have been good if I could have talked about, how long and how many places they had to look at before choosing that one.
I think reminding people that we're not the only shelter in the county.
Right.
That's another thing that, we got too many here in Route 1. That's been
Right.
here 30 years, and that's been the speech for 30 years.
Right.
And it's not actually true in terms of homeless shelters.
Right.
Right.
So,
Has any consideration been given to the vacated Sunrise building down in Winston Plaza?
yep. They
Or
look,
if it's no longer trying to deal with that, it became much too complicated.
that's why it's still vacant. You are not the first or the last to try to deal with that. Yeah. But it
The
was,
neighbors, we surveyed the neighborhood, I interviewed all of the store owners and business managers. They were all in favor of it. It was the South County area,
community, yeah.
not even the people. I mean, when it was brought up at a South County meeting, the people were shocked that this was being taken so long.
Mhm.
It was the managers, the officers that had some other interest, but it's still vacant.
Yep, it's been vacant for years.
Pam or David, do you see any, there's some FEMA money that's now allowed to buy some of the hotels people have been being put up in during COVID. Is there any place along Route 1 that would be a candidate for that?
No. I mean, the simple answer is no. The county's looked at the motels on Route 1 for the last 30 years that I've been
Yeah.
here.
They've
And
looked
they're-
pretty closely at them.
Yeah, and they're a piece of crap, frankly.
Yeah.
So,
Tom did mention that he received that set of information from you, Mary, and about the FEMA money being available. Tom Barnett at OPH.
Oh, good. Yeah.
so it's paying for the hotel right now. That's being
Right.
used for both of ours, all of them.
I
We
think
have-
we should, Tom, on the video, Tom Fleetwood was saying he was looking at, I think he said 30 to 50 affordable housing units would fit on the site. And
In addition to all this other stuff, yeah.
That's what they said.
So-
yeah.
with the other stuff, so that would be good, but maybe we should talk to them and, get on the same page with them. But it seemed to me like the permanent supportive housing was really lacking and really a need for that, as maybe we should have a little more of that too.
Yeah,
20 units right now, but the need was much, much, much greater for that, even in this area, not
Talking about
counting the
big,
rest of the
yeah.
county. Or does that get too big? If you have too many at one place, does it not work right?
well, we haven't had any that are too big, so we
We
don't
haven't
know.
had that problem.
Yeah, 20's been the max so far.
I think we probably have just a couple minutes before we shift over with the health department joining us. This was a great discussion, I think. And I agree, we need to invest a little work in talking points and common answers to some of those key questions. Are there any other updates or announcements that should be shared with everybody before we shift gears? If you just raise your hand or speak. I know many of them are in the chat.
I think, Joe, may I say something?
Yes, please.
As you know, tax season started. I don't have date or enough information about VITA, how it's going to be working, but they are going to be working virtually mainly. And that is going to bring a lot of trouble, I think, for some clients. AARP has some availability to do drop-off and even in person. I can place in the channel here, in the chat, the AARP link. So if you have clients or maybe people around your community and they are trying to find access for tax preparation, they can actually contact and do everything. AARP works for people 50 and over and also low income. So I will put that information here.
Great, thank you.
Have our speakers arrived yet, Joe?
I'm just looking and I'm sorry, I somehow shrunk this whole call to a very small box.
I'm so glad I'm not the only one who screws this up.
I did the same thing.
God.
I don't believe
I see Sharon Arndt from the health department. So, yep.
Great. Let me just try once more and see if I can open this up. Sharon, welcome.
Thank you. Thank you, everyone. Can you hear me with no problems?
We can, yes.
Okay.
And thanks so much. We know how incredibly busy you are with everything going on with the pandemic and vaccination. So we really appreciate the time and you're being willing to spend some time with us today.
Of course, no problem. You know, for the health department to successfully vaccinate all who are eligible in our health district in Fairfax County and Fairfax City and City of Falls Church, and as we work with our neighboring communities like Alexandria and Arlington and Prince William, I mean, public health can't get this work done without folks like you helping us, helping us to connect to those who are not attached to the whole vaccination process or may not even know what's going on. So we do appreciate the time with you all to share with you the work that Fairfax Health Department is doing to address and to navigate this pandemic. And we are looking forward to some conversation at the end of Dr. Ben's presentation to see how you all can help us and provide us some guidance and partner with us to help us identify those who are at highest risk of disease. So today, I know Joe is very familiar with me, and Allison, it's nice to see you, and many others. I think I've met you along the way, but my name is Sharon Arndt, and I am the Division Director for Community Health Development at the Health Department. And during this pandemic response, I am the Assistant Liaison Officer for Community and Nonprofit Organizations. So happy to be here with you today and to support you, and hopefully we can answer your questions. But I do want to introduce Dr. Benjamin Schwartz, who is our Medical Director of Epidemiology and Population Health. There's Dr. Ben. And Dr. Ben is going to provide you an overview of the disease and vaccines. And then we are looking forward to having a little conversation to share with you our vaccine equity strategy. So without further ado, Joe, I'd like to introduce Dr. Ben Schwartz, and he will like to share a screen.
Welcome.
Hi, thank you all. And I'm not going to share my screen immediately, but if it's possible to do later on in the remarks, I would love to do that. So as Sharon said, we really look forward to working with you. What I'd like to do in about the next 10 minutes or so is just to provide a brief update, some of the new developments in terms of both disease and vaccine, and then to talk about the vaccination program and the progress that we're making in Fairfax County. So just where we are right now with disease. At the beginning of the year, we had as many as 700 cases per day in Fairfax County on average. Now we are all the way down to an average of 180 cases per day. So that is certainly significantly better than where we were a couple months ago. But I want to point out that 100 cases per day, 180 cases per day is over 1,200 cases per week. So we still need to be as rigorous as we can be in terms of all of the mitigation measures, mask wearing, staying home when sick, social distancing, etc. And we certainly can't let our guard down. Now, there are two new developments that I'd like to highlight. One of those is something you may have heard about, the new variants of COVID-19. And these are COVID-19 viruses that have gone through mutations. And some of those mutations, unfortunately, make the virus easier to spread between people. Some modeling suggests that what's become known as the UK variant could even become the predominant strain in the United States later this month. Just earlier this week, we had the second case in Fairfax County of someone who's been identified as having this variant strain. So the importance of this for you is, again, the emphasis that if we are seeing strains that might be spread more easily, it even puts a greater priority on rigorously maintaining all those mitigation measures. So we really need to make sure, again, that we keep up the good work. The second new development is something much more positive, and that is the FDA's authorization and CDC's recommendation of a third coronavirus vaccine that is produced by Johnson & Johnson. And what is particularly important about this vaccine is that it is active with a single dose. So only one dose is needed for protection, and 28 days after receiving that single dose, one is fully protected against COVID disease. Now, the data from the clinical trials of this vaccine show that it's effective in preventing COVID infection, but it is particularly effective in preventing severe COVID disease. So the number for that severe disease was 85%. And for hospitalization in the clinical trials, it was actually 100% protective. So the thing that I would emphasize for this vaccine is the high efficacy against severe disease, against hospitalization, and against death, as well as the ability to be protected with a single dose. So now we have 3 vaccines that are part of our armamentarium against COVID-19. And this means that we'll have a lot more vaccines in our county and be able to vaccinate our population that much more quickly. So let me move to a brief update on what we're doing in our vaccination program. You would think that we would have a number, and I could say to you, there are this many vaccines that have been administered in Fairfax County, but unfortunately, I can't give you a single number. One of the numbers that we have comes from the Virginia Department of Health, and they have a vaccine dashboard. And what they report today is that there were 152,000 people in Fairfax County who have received vaccine and 89,000 who have been fully vaccinated. But we know that their numbers are a little bit delayed because the information doesn't get to VDH, to the Virginia Department of Health, right away. So the Fairfax County Health Department on our dashboard says that we've administered 176,000 doses working with partners. And then ANOVA says that they've administered across all of Northern Virginia 177,000 doses. So I just wanted to assure you that we are doing better than it appears with the Virginia Department of Health numbers, but I can't give you a specific number. Based on the VDH data, we've vaccinated about half of our older adult population, those who are 65 and above. And that's really, I think, an incredible accomplishment and something that is really encouraging for all of us. In terms of the vaccination priorities, we are vaccinating people in so-called phase 1A, who are healthcare workers and long-term care facility residents. And I want to point out that the healthcare workers also include primary caregivers of people who are disabled and need significant assistance with their activities of daily living. So people who are those primary caregivers can get on the list for vaccination. And then phase 1B includes people who are 65 plus, people who are ages 16 to 64 with high-risk conditions, as well as a number of occupational groups, including police, fire, and hazmat, corrections and homeless care staff, teachers and child care staff, and then other occupational groups will be coming down shortly. And so it's important that we all know who is eligible for vaccination. So the final thing that I'd like to highlight is the vaccination program components. And I'm going to quickly mention 5 different components, and then we can have a discussion, and Sharon and I can answer any questions you have about that program. So the first component, and the biggest one by far, is vaccination from the county's pre-registration queue. And you're all familiar, I hope, with the ability to register if you're in one of those recommended groups. And that registration is best done through the county's website, but also can be done through a call center that the county has. And the number is on our website for that as well. Or it's, if you're writing it down, 703-324-7404. And so by calling that, people who may not be as familiar with the use of the technology could also register for vaccination. There are over 268,000 people in Fairfax County who have registered through that site. And most of them have already been reached and have been invited to be vaccinated. There are currently 94,000 people who are left in the queue. And people who are being invited for vaccination now are those who registered on January 19th. So it's been a delay of about a month and a half, but we are working through that queue as quickly as we possibly can. There are multiple sites where people from the queue can get vaccinated. They include the government center, where the health department is providing vaccinations, in Merrifield, where Inova is providing vaccinations, at Eagle Bank Arena, where GMU, George Mason University, is providing vaccinations, and then a number of other sites with various partners, including Kaiser, including several pharmacy partners, and so on. And when you get invited to be vaccinated, you may get a choice of those different sites. So that is the, if you will, the flagship county program for vaccination. There also is a federal pharmacy partnership. And in that partnership are a number of Safeway pharmacies, a CVS pharmacy on Prosperity Boulevard, and My Doctor's Pharmacy in Herndon. And those pharmacies are working from their own registration systems. And so if you would like to get vaccinated at one of those sites, you would need to go to the pharmacy's webpage and use their own registration process. Their federal government is also giving money, or not money, giving vaccinations to the federally qualified health centers. And in Fairfax County, so far, this includes Neighborhood Health, which is one of our major safety net partners in the Richmond Highway area of the county. And they are getting vaccine directly from the federal government, as well as getting it from Fairfax County, vaccinating their vulnerable population, but also helping us vaccinate people from vulnerable populations as part of our equity strategy. So certainly I want to point out that Neighborhood Health and HealthWorks both are important partners. The National Long-Term Care Pharmacy Program is one that has vaccinated residents and staff in skilled nursing facilities and assisted living facilities across the county. And this is where I'd like to share my screen. And so let me just see if I can make the technology work. Sorry about that. Let me just, whoops. Okay, so let me see if I can get it out here.
Should be working.
Yeah.
Okay, so I'm not
I'll
sure.
go down and get it. I can go down.
I'm not sure exactly what you're seeing now. Are you seeing the long-term care facility slide?
Yes,
Yes.
sir.
Yes.
Okay, and I know it's not in screen show, so it's probably a little bit messy, but let's, for purposes of brevity, let's just go with this. So I want to point out that through this program, there have been 66 skilled nursing facilities and assisted living facilities that have had at least one vaccination clinic, and the large majority of them have had 2 or 3 vaccination clinics. You can see how successful we've been in getting staff and residents in those long-term care facilities vaccinated. And if you compare the Fairfax numbers with the national numbers from CDC, you can see that in Fairfax, we've been much more effective than many of the other jurisdictions around our country. The impact of that is shown on this slide, and I think this is really impressive, and that's why we wanted to show it to you, so that you can see in the kind of reddish line the number of vaccine doses that have been administered in long-term care settings. And so vaccination began last December, and you can see that red line going up to where we've administered almost 8,000 doses to residents and staff of long-term care facilities. What the blue line shows is it shows the decrease in COVID disease that has occurred. And we've gone from a peak of 32 cases per day down to the point where now in long-term care, there's only 1 or 2 cases per day. And this is certainly a remarkable accomplishment for our most vulnerable communities. But it also, I think, is an illustration of what we hope to see for Fairfax County broadly as we can vaccinate more of our population generally. So I wanted to share that good news. The final piece of our vaccination program that I'd like to describe is our county's vaccine equity strategy. So one of the things that we know is we know that people in some of our most vulnerable populations, in the African American community and in the Hispanic community in particular, may be hesitant about receiving vaccination. And therefore, because of the hesitancy, because of difficulty with access, with transportation, perhaps because of the digital divide and not having the technology, perhaps because of some issues of trust with government, may be less likely to register for vaccination. And so we want to reach out specifically to these communities to help people register and have an opportunity to get vaccinated. So for this equity strategy, we are working with our safety net partners, with Neighborhood Health, with HealthWorks, with the Adams Compassionate Healthcare Network, the Colmore Clinic. We're working with pharmacy partners like Safeway, with Inova Cares Clinic for Families, which is the Inova charity arm of their health system, and with a number of private doctor partners to vaccinate people from these most vulnerable communities. So what you can see on this screen in this next slide is a number of the established and proposed clinics that we are going to be having with our community partners to vaccinate under this equity strategy. And so you can see that the partners listed on the left, you can see some of the geographies, some of the locations where vaccination is going to be done, and the population served under these programs. A better way to get the sense of where this is taking place is to look at the map. And what's shown on this map is the blue is the more vulnerable locations in the county that are shown in the darker blue colors. In the orange, yellow, and red are the hotspots for disease in the county, the places where the most cases have occurred. And then in those squares and hexagons are locations for the vaccine administration sites. And so you can see that in many of those hotspots, there already are existing or proposed sites for vaccination. And in other hotspots, like in Lorton, in Springfield, and in Centerville, Sharon is currently working to help identify sites where we can vaccinate as part of the equity strategy. And so our goal is to be able to bring vaccination closer to the people and to be able to work with community organizations, including with the faith communities, in order to identify people from vulnerable communities who can be vaccinated as part of this equity strategy. So that is what I wanted to share with you as the introduction. And hopefully we can have a discussion and answer any questions that you might have.
So thank you, Dr. Ben.
A question?
So I do have some questions in the chat, and Joe and I were going back and forth. I'll facilitate and answer some that I can answer, and Dr. Ben and I will answer your questions. One of the questions I get in the chat is that questions about where folks in South County can get the vaccine. So we have vaccine appointments available through the health department's work at the health department's Mount Vernon district office, which is located in the Jerry Highland South County Government Center building. Now, a couple weeks ago, we only had, we were working on our first doses and second doses and catching up from all the first doses, needing to get the second doses. So, but at this time, there are first and second doses available at the Jerry Highland South County building in the health department's facility there. In fact, I think this Saturday, maybe it's this Saturday, no, it's not Saturday, but anyway, this week there are 288 first dose appointments. So that's been a question for residents in the Richmond Highway area. Where can they get vaccine? Our Mount Vernon district office has traditionally been the last to fill up throughout the week. So there is capacity there, and now we are shifting to offer first dose appointments there as well. And we are working with pharmacy partners, as Dr. Ben mentioned. Residents of South County will find a couple of giant stores when they go to register for their vaccine. There are some giant stores, such as one in Kingstown that is closer to the Richmond Highway area. So those are now available. And I do want to just provide a distinction between the Mount Vernon district office and the and Knights of Columbus. So as Dr. Ben said, the health department isn't the only vaccinator. We are working in partnership with Neighborhood Health. So Neighborhood Health has their clinic operations in the South County Government Center building, but they have also stood up clinics working in partnership like with United Community for the Knights of Columbus. And those vaccine clinics are for Neighborhood Health patients, as well as those who have limited options in the Richmond Highway area. And that is just the start of our work in the Richmond Highway area. And as Dr. Ben mentioned, we're looking for other equity vaccine clinics, and we are actively looking right now to locate something in the Lorton Gunston area. We are trying to find a site, and we are underway with that.
Okay, even after you have this site identified, how do you identify those folks that don't have computer access and don't have minutes on their phone to actually schedule an appointment? How are you identifying those folks, which predominantly live in the highest risk area? You've ignored those folks.
So the county's registration process is done either by phone or by registration online. As part of the equity strategy, we are working with community partners in the most vulnerable communities. And this includes faith-based partners such as Voices for Black Fairfax. Is that the right?
Voices of Black Fairfax.
Voices of Black Fairfax, which is a group of a number of faith leaders. We're working, as Sharon said, with United Communities. In the Hispanic population, we're working with Second Story, with EduFuturo. in each of the different communities, those local community organizations are going to be different. But we are really seeking out community partners, including faith-based partners, to help us identify people who can be vaccinated, not as part of the queue, but as part of this equity approach that we're discussing.
That sounds like if you're part of an organization, then you can get, they'll reach out to you. How about people that are totally isolated, that have no affiliation with the church or with any other organization that you've mentioned? How are they being reached?
Well, we hope that organizations will seek out people who are at risk and who are vulnerable. There are multiple different ways that people are, that the health department is communicating with people. You know, through the media, through various partners, through, if people are disabled, through disability organizations, through Meals on Wheels for seniors who may be utilizing that service. So all I would say is that there are multiple communications channels, multiple approaches to try and reach people and to cast the net just as widely as we possibly can. But if you and your organization know of other ways or additional ways to reach people who haven't been reached, we would certainly welcome those suggestions.
Okay, I suggest something that's been happening on the West Coast. A friend of mine lives out there, and he said the fire department's going door to door, knocking on doors. And all they need to do is ask, are you interested in getting the vaccine? How old are you? You know the questions, probably 5 questions, and you can get a positive response. One of the clients that I had was on the phone for 4 hours on that phone line waiting. And if they're paying for minutes, you know, after an hour and a half, they get cut off.
Yeah, and I know that that's been a problem. We're working with the Department of Information Technology in the county to try and resolve that. But I will say that we certainly all hear of people who are on hold for a long, long time. But I am told that from the call center that the average hold time is somewhere between 6 and 12 minutes. So, you know, I don't want to minimize people's experience in any way whatsoever, but the average hold time certainly is fortunately not quite that long.
Dr. Ben, this is Allison DeCourcy from United Community, and I just wanted to give an example. It's not door-to-door firemen or firefighters, but it is going where the people are, right? And I posed in the chat, is anybody from neighborhood health on the call? So if so, identify yourself. But you know, we do have a partnership with neighborhood health, and they are encouraging us to send the first tranche from request was our clients 65 and older, and that happened. And but how that's happening is in food pantry lines, right? In community distributions of food, in community outreach to families who are enrolled in programs. So it's very organic. It's not dial this number and hop in line. It's meeting people where they are, that quote. And you know, that's how we're doing it. And so, you know, just as Dr. Ben said, you know, he encourages us to think about, you know, how we can reach the folks in our sphere. We're going to have to get creative, and I would say this, that it's still a challenge. Are we moving the needle in the way that we had hoped to? Not quite yet. I mean, to a point, I think maybe that Sharon and Dr. Ben were making earlier, you know, there's, you know, misinformation out there, there's hesitancies for various reasons, but it's why we're hearing from these folks so we can share that information and then get the information about, you know, for instance, what neighborhood health is doing or what the health department is doing and lower those barriers. So I just wanted to share that kind of that equity approach that we're taking.
Yeah, thanks so much, Allison. I really appreciate the work you're doing and being able to share that with people. I'd also point out that we're working with apartment complex managers. And one of the things that we learned when we were doing testing in the community was that some of these apartment complexes have particular high numbers of at-risk people. And so now that we know many of those managers, we can work with them to help identify people in their facilities who need to be vaccinated. So again, multiple different good ideas at the community level.
I have a question on how you know if you're doing well or poorly. Do you have any metrics? I mean, how do we know in the Route 1 area how many of the vulnerable population is getting vaccinated? How do you know that in any way, county or neighborhood health or whatever? How do you know if you're getting it done?
Good question. Certainly one of the best metrics is that all of our equity clinics, all of our neighborhood health clinics, the clinics at Bailey's Community Center, the upcoming clinic at James Lee Community Center. We want to make sure that all of these clinics are fully subscribed, that we have every single appointment being taken. And so, that's certainly one of the measures. Are we vaccinating as fast as we possibly can? A second measure is looking at the racial and ethnic distribution of people who are vaccinated both from the county's registration queue, but then also based on the information from the Virginia Department of Health, from the Virginia Immunization Information System, which is our state vaccination registry. So we'll be looking at those data as well to see if we can reduce the racial and ethnic disparities that we know exist within our county.
Dr. Ben.
This is Brenda Faison, and I'm sorry, Reverend Abe.
Go ahead. You're probably going to say the same thing I'm going to.
I'm working with Neighborhood Health, and I'm working with Bethlehem Baptist Church. We're working with Neighborhood Health, and we're also working with Voices of Black Fairfax. And the concern we have is that you only allotted us 100 slots per week with Voices of Black Fairfax. And we are working with about 75 churches and probably even more. So is there any way you can give us more slots? And as of last 2 weeks, we've been registering people from 75 to 100.
Yeah. I'm sorry if I interrupted you. Your work has been phenomenal, and we want to work with you more. Just anecdotally, we've been recruiting for a clinic in the Bailey's Community Center, and as I mentioned, one at James Lee. And most of the people registered come from our Hispanic community. And so we would love to be able to get more people from the African-American communities across the county. I'll talk with Sharon and with Sam Collins, and we'll see if there are ways that we can work more closely with you to vaccinate more people that your group is able to identify.
So
Yes.
I do
This is
want to provide some additional clarification on the work with the Voices of Black Fairfax. So the clinic that you are specifically speaking of is with the 100 doses a week is with NovaCare's Clinic for Families, which we stood up about 2 weeks ago. And just yesterday, I was talking to, or 2 days ago, I don't know, days get all mixed up. But in working with Ramona Carroll, the work that we are currently doing at James Lee Community Center and the Bailey's Community Center, what Voices of Black Fairfax are connected to that work as well, seeking to register. So over 200 people, just in a couple of days, over 200 people have registered for the James Lee Community Center vaccine clinics. Tomorrow and Saturday, we're nearly full. And at James Lee Community Center, we just opened it up Monday evening, and just an hour ago, I had 163 registered. So we are.
I
we are
have a waiting
trying to
list
bring-
of about 200 people, so.
That's great. That's wonderful. We're gonna, we're bringing these vaccine equity clinics online as fast as we can. And for you all to identify residents who you work with who are 65 plus, who have not had the opportunity, if they have not been successful with the county's process, for you to identify those folks, as soon as we have that vaccine clinic stood up, we can reach and work with you all to get our 65 plus residents registered. So continue to identify, and we are moving and trying to lift up these vaccine equity clinics as quickly as we can.
And Sharon, maybe after this call, we can link them up with Sam to see if we can do some more registration.
Yeah, to Ben and Sharon, this is Pastor Smith. And let me applaud you for the efforts and the work that you have already done. And to piggyback on what Brenda Faison has said, now I live in PG County in Maryland, and my church is in Alexandria. And what we have done in PG County, we've opened up sites at different churches where the vaccine has been provided. I didn't see on your list any church, specifically a church of color, that they have been opened their churches up, or they have been identified as a resource center to provide the vaccine. That has proven itself beneficial. It would also help to deflate some of the anxiety, some of the vulnerability, the lack of trust that you mentioned earlier. I would strongly suggest that through the voices of Black Fairfax and maybe any other organization, that you would look at creating a site or sites within with maybe one or two of the larger churches, Black churches in the Fairfax County, to use that as a means to facility to vaccinate, to open it up. I think that will help in deflating some of the anxiety, some of the lack of trust that you spoke about. I would strongly suggest that, because that is proven, and I'm not using PG counties as an example, but I'm saying that has worked and it worked well for us.
Now, thank you for that suggestion. We've certainly thought of that as well. And right now, the health department is focusing on community sites where we can go back on a regular basis, on a weekly basis or several times per week, and bringing it into the communities in that way. But I know that churches could offer another option for vaccination.
Absolutely.
I think you're right in working through the local organizations and the churches, but this is kind of a recurring issue with the county trying to reach vulnerable populations. There's not a county, if you're going to do it that way, I think it's good, but you really need to also supply some of the materials or some electronic communications help, or you're putting an extra burden on the community organizations, and they do want to see everybody vaccinated, but to go outside the regular clients and kind of hand out something with something else they're doing doesn't reach everybody. And I think you should think about providing materials with the phone numbers, not the links, and the basic information, and telling people that the vaccines are free. A lot of people don't seem to know they're free. They don't go because they think they're going to have to pay for it. And I worked with NACP on getting people to call the 222 number, and we sent out some Facebook ads to the lowest income zip codes about how to do that. And we got a pretty good response. We got 500 click-throughs in a very short, small campaign. I mean, you really need to think about some of where people who are vulnerable, where do they get their information? you need to know that and then use those information channels. And it may be posters in grocery stores. They may go, out. Where do they go out? They might go out to shop or to, you need to find those places and put materials up if that's how they get information, or think that through and provide materials that then community groups can use to distribute, and think that through with some consultation from people, from the groups.
And thanks for that suggestion. We can certainly work with our communications team and then with Sharon's team to make materials available to community partners.
So I'd like to ask the group a question. We do recognize that the Black churches are certainly a trusted sanctuary for our residents. One of the struggles we do have with operating vaccine clinics is because of the nature of this pandemic, we have to maintain social distancing. So really having a large space is important. That is one of the reasons why the Knights of Columbus facility on Richmond Highway was selected by Neighborhood Health, because it gives the space needed for social distancing. But I am interested in what you all think. Is the Gum Springs Community Center a place that would be a trusted sanctuary and a place that residents would be willing to attend for a vaccine clinic if the houses of worship are not found to be large enough, or they can't be set up well enough to support a socially distant clinic? So I'm curious what you all think about the Gum Springs Community Center.
Can I say something? This
Yes,
is Brenda
please.
Faison, and I know I'm speaking on behalf of my pastor, who has been sharing with with you for the last 2 weeks and has offered Bethlehem Baptist Church as a site. Our multipurpose facility is large enough for 300, almost 300 people. We've had large groups of people. You can spread out in the facility, and it has proven over the years to be a trusted place for the community. We do food distributions there every week, and we are servicing about 200 families. And I think that that's a site that you should consider.
I totally support that. I think that's a really good idea. Bethlehem Baptist has the facility and has the accommodations to provide the kind of necessary distancing and space that you're looking for. I just had that experience at another church in PG County, and it's about the same size. So Bethlehem is an excellent facility to do that.
You can certainly understand that we've already had many of these conversations with Dr. Gloria, with our director, and the concerns that have been expressed are the ability of a facility to be a regular site for vaccination week to week, with that being preferable to us, because just logistically, it's easier if you can use a site regularly, like Knights of Columbus, rather than a site in a church here 1 week and a different church the next week. You can imagine that would create more logistical challenges. The other thing is that we'd like to be sure that we can provide vaccine equitably, and that if some churches want to vaccinate, do we have the capability to meet the needs or the demands of other churches that also wanted to host vaccination sites? And so those are just some of the issues that we've talked about. I know that we can have a lot more robust of a conversation, and maybe to take this conversation offline would be a good way to continue to explore those issues.
Could I just ask perhaps that just if anybody, Brenda, do you have a comment or a thought on Gum Springs and Sharon's question there as well? I mean, I understand that we do want to follow up on Bethlehem Baptist.
I don't have a problem with Gum Springs. I think, no, that's not an issue. I just think that for the health departments and the view of the African American community right now, it's not feeling too good. And I don't think we're asking that you use all churches. It's just that you at least select a church and use in the county.
Agreed.
And to make sure, I mean, we've gone to Seminary Road, we've gone all over the county, and it just kind of looks like a sore thumb when you ignore churches that are sitting in communities and churches that have been very effective in working with the community, and especially when they open their doors and offer.
Okay. Absolutely.
Totally agree.
Also, the only thing on Route 1 you've got right now is the KFC. And these other locations
Mary,
are not.
that's not true. They also talked about the Highland Center,
Yeah.
right?
Yeah, that's real new. That wasn't offered to me. And I'm getting a shot today at the Giant, but that has not been on the list of where you can go. Maybe it's brand new. But the other centers you're mentioning aren't really close to here. And a lot of people who live here don't have cars. They need to take transit, or I guess the Shepherd Center is giving some rides. I'd like to hear what kind of demand you're getting and if people know about that option. That just was recently installed. And I don't know if that's been communicated to people in the community yet. It doesn't come up, there's no offer of a ride when you register or get your appointment. So yeah, I think the other, Bailey's is kind of far from here if you don't have a car.
Very little people, very few information from the Shepherd Center, because those people are not being reached. They don't know anything about the vaccinations, as I stated earlier. I did get one call today from an individual. The call came in at 10:30. I need a ride up to Beauregard Street at 12:15 to get my appointment. This is not convenient. This is virtually impossible for us to manage.
So I would, for that exact question or scenario that Bob offered, we have been working very closely with the county's Human Service Transportation Program. And there's a couple of options for transportation, and we certainly know our Shepherd Center partners are a great option for when it works for residents. If it doesn't, for this like emergency, I need a ride, my rides have fallen through, what have you, we have set up our health department call center with the Human Service Transportation taxi program. So that resident could call the call center and say, I'm stuck, my appointment's in 2 hours, my ride's fallen through, I don't have a way to get there. And the health department call center can support that resident with a taxi, or they can call during the business week, Human Service Transportation. So we do have an immediate taxi system in place for those with emergent needs to get to their vaccine appointment. And the other thing that we are working closely with, as the Voices of Black Fairfax are registering folks for the appointments in Annandale. We've already, as of yesterday, we had offered 16 taxi rides for those who did not have a ride resource. So there, we are trying to support all of our residents with accessing vaccine and hoping to mitigate the barriers by bringing vaccine closer to the community. And we are working every day to try and bring it closer to the community, but also working with our partners like NV Rides or Shepherd Centers and Human Service Transportation to bring online other resources to get people to vaccine.
Hello, my name is Diane Watson. I live in Lorton, and I just got word about this meeting and the link, so I've been late coming in. But in recent meetings that I've had that have included some county health officials, they've indicated that you could call the health department line to get a ride to get vaccinations. Now, what I'm hearing from Bob and some of the rest of you, and I know I've heard previously, the problem is also that some of the people just don't know what is available out there. So this health department, actually calling the number that ends in 7404, I'm looking for it in front of me, but that is supposed to be the number that the COVID call line is what they call it. And if you have need for transportation, let them know as well, and they may arrange for some additional partners outside of what those that you voiced. I put my information down there too in the chat box if anybody wanted to speak to me and you know, let me know some of the concerns that I might have missed here. I'd appreciate it.
I'm going to jump in quickly and say that I've made so many calls for families who speak Urdu, and it's not easy. It's the days that I've called, I haven't had a 6 to 8 minute wait. I've done an hour and a half, 3 hours, 4.5 hours one day just to get a family an appointment. So if they need a ride and they have to call that number, you're still sitting in the same wait line with everybody else to try and get in. And then the second part of that problem is that you still expect some type of technology. It doesn't matter. Either I have the computer, they have a computer, all that information has to be, the information has to be put in. So we don't have hard copies to give families so that we could fill it up for them and they walk up with it. And it's hard because one family has one cell phone. And when you go with multiple people, they want multiple emails, they want cell phones, they want ways that they can get a hold of you. What do I do with a family that only has a landline? Those are all issues that we have to be aware of, and they are huge in both opportunity neighborhood settings. And so we have to be mindful of the fact that yes, some you know, Richmond Highway corridor people can get up and down using the bus, but again, that information is not as accessible. I mean, you really have to be in the know to be able to get the vaccinations to the right people. And the school system is trying with parent liaisons, with community outreach. We work with your nurses all the time. Kirsten used to work with us. So we work really hard to try and help, and we're trying to get families to say, okay, if you have a child and your child has a laptop, we can work with you and you can register through that. We're coming up with any and every avenue possible, but just know that there's just 1,000 barriers along the way. And even though that family has that laptop for that student, they may only have a landline. To say that somebody has a cell phone or needs to go out and then purchase a cell phone so then they can do this is asking a lot of them. And we don't let them in the building right now, right? If they're immunized, they can probably come in the building, but we don't have that access either. Come use our computers, come, let's help you. We can't do that. And I just wanted to put that out there for you all because it's really important to know that families are isolated, and those that do have the computers and can do that, that's great. But there's so many families that don't even have a telephone.
Dr. Ben, when people go to register or somebody is registering for somebody else, is there a way to have that person who's facilitating's email or phone number put in so that when the person comes in, they could be notified and they can then tell the people who need it?
Yeah, this is something that a lot of grown children might do for older parents. If the kids use the technology, they may put their own email address and their own phone number. And so the communications from the health department would come to them, but the name of the person who's being vaccinated would be their older parent. And so, yes, that is definitely something that can be done. But let me just make a quick comment. I hear a lot of frustration. And I know that, that there are challenges out in the community, that there's a lot of frustration in the community, and that, the health department is not always as flexible in terms of the number of options that we would like it to be. But that said, that's why outreach, and that's why community partnerships, and that's why working with organizations like yours is also important, because you have the flexibility, you have the contacts in the community, you have the volunteers that you're working with. And so, we certainly can't do it alone. And we need your help, we need your partnership. And we will try to make it as easy as possible, but that isn't always something that we can do as well or as immediately as we would like.
I think one of your sites along with the church could possibly be Mount Vernon Woods Elementary, which is deep in the community, or Woodlawn Elementary. I would say get not only Dan Stork on, Supervisor Stork on, but get Karen Corbett Sanders and Tammy Koufax to come together to say, what are the other facilities we can use so that everybody doesn't have to go 3 miles. 3 miles is a long way to get to somewhere. Where it,
okay, thank you. And I'm interrupting, I'm sorry, just because we do have a hard stop at 1 o'clock. I know Dr. Schwartz and Sharon are just super busy. I did see in the chat a suggestion that maybe the phone line could implement something that I think, when the 222 number was getting a lot of calls around the eviction payments, they eventually were able to implement the ability to do a callback, and that to leave a message and call back rather than waiting on the line. I don't know if that's something, it of course takes the number of staff to be able to do that. And I know you all are really dealing with tremendous volume right now as well, but that might be something worth considering.
We'll see if we can do that.
On behalf of Vic, I mean, you heard the passion of everybody here, and the commitment to our vulnerable communities. And I know as you guys came today, you're already working on plans to address the most vulnerable communities. So we want to appreciate that and acknowledge that. And, this conversation today is in the spirit of how do we figure out how to do this better together? We want to thank you for your time today and for all your work that you're doing. And however we can help with whether it's Bethlehem Baptist or with the outreach to community, we certainly are all in.
Thank you.
Thank
so
you
much.
both.
Yeah, thank you.
Yes.
Thank you.
Yeah,
Thank you. We look forward to coming back and continuing to work on this with all of you. So thank you for the welcome today.
Thank you. All right. And again, I know some folks joined late. We have recorded this, so you'll be able to catch up on all the information. Bill, do you have any wrap-up announcements?
No, I'm just going to remind everybody that we'll have the video available, but also that the chat is being saved, and I will see that it goes out to our distribution person, Christina, to get to everyone who's attended so that you can see the chat as well, because that has all these links and things in it that are important and phone numbers. So I will make sure that you all get that.
And I think we all know that across the community, right now, still the demand for vaccine really outstrips the supply, and that there's so much frustration in the community about how to get it. I do think it was valuable for Sharon and Dr. Schwartz to hear our thoughts today. So, we need to continue to represent, and we should think about how we can work with the health department, to bring those to our communities and bring our communities to those sites.
Yeah.
So, thanks everybody. Any final thoughts, comments?
As I mentioned, I joined in late, and right now I'm right on the LTCC COVID impact and response team. And I have my information, my email and phone number there. If somebody could please get in touch with me, because this is exactly the kind of things that we have to earmark and address. So I appreciate it.
Great. Thank you.
Yes, Joe, I want to just say that Bethlehem is, as you heard, we're working with the county, and especially if you know of any persons of color that are trying to get registered or are trying to get a vaccination, you can have them to send their information to my email, and we will try to get them in as soon as possible in working with neighborhood health and the county. And especially Reverend Smith, your members.
Yeah, thank you. I appreciate that. Yeah, we have put out a list of sites and so forth, so I'm willing to work with you on that. And I think we really do need to push. If they really want to support equity strategy, I think they got to get these Black pastors and other folks involved in it, and to use. We have the facility. We have the facility. We need to push that.
From my experience in doing the Martin Luther King celebrations at Bethlehem Baptist, it seems like that would be just a fantastic site.
Absolutely.
Yeah.
Brenda, is there any problem with having it be a recurring site? He kept going back to it's got to be a recurring site.
There is no problem because right now we are not at the facility. And I know Pastor White has been talking with them for the last 2 weeks, trying to get them to use Bethlehem. So
yeah,
that has been our push.
Good.
So I think any support that we can get and encouraging them to see an African-American church at the site will be good. And we're at a point that it doesn't have to be Bethlehem, any African-American church in Fairfax County. And we're not saying all, we're just saying one, even two if they have to, but not to just ignore us.
It's worked.
I wonder if their concern is if they select one church, there will be other churches that feel slighted. And maybe we could help them allay that concern, at least.
Well, the pastors, the African-American, there are 3 pastors that have been meeting with them for the last 3 weeks. One that represents the association, and they're all saying we don't care. We just need to get it into the community.
Okay. Yeah.
Got it.
And the other issue that we're finding is that many African-Americans have registered early, have not been called. I've been registering I registered a 99-year-old lady last week, and she should have been called weeks ago.
Did you say you re-registered her, or she was
I'm sorry, I put her in the queue so that she could get her vaccination. She was already registered.
Okay, she was.
Yes. So there are, the myth is that African Americans are not signing up. That's not true. There's quite a few of us, many of them have signed up. They just haven't been called to come and get their vaccinations.
Brenda,
I know of a number of people that we know have the same frustration. With the registration site, and there being glitches, and they wait several weeks and then realize nothing's happening and have to go back on.
Are these registrations before the January 18th date? Because I understand
there was some sort of issue before January 18th, and that was several people hit that.
Yeah.
Okay.
Yeah.
Neighborhood health has been has been really a blessing for us. And,
neighborhood health?
Yes, neighborhood health, yes.
I was glad to hear that they're working with neighborhood health. That seems very good.
Can somebody tell me the number for this neighborhood health? I have not heard this before. Anybody have that information in front of them? Or if I have my information in chat, could you also put that number in for me? I'd appreciate it. I've heard that term used several times during this conversation, and you just don't know what you don't know sometimes until you happen to come into scenarios like this.
Yeah.
I think if you Google neighborhood health, it's a provider, low cost provider in the community here.
Thank you. I appreciate that.
Yeah. Oh, and they'll just put the website in.
Thank you.
Yeah.
Okay. There was a lot today.
It was a lot today.
Yeah, but that's a good thing.
Good.
I think they heard us, and I think that's valuable. And we'll see where we go from here, right?
Thank you.
And the next meeting in April, the first Wednesday of April. Oh, I don't have the date in front of me, but anyway, we have Don Byer, Representative Don Byer, who will be asking questions of. And listen, everybody who's still here, send to me or Joe or to info@venturesinCommunity.org any questions that you would like Don to address.
Right.
All right. About any issue, in particular, of course, affecting our area, but any issue that you feel needs to be.
And Bill, our April meeting is at the usual time, right? It's during the day.
Yes, it's during the day. That was the only time he was available.
Right. So
was during the day. So it will be, hold on, April 7th at 11:30.
11:30. Yep. Very good.
All right. So we'll see you all then. But please send questions for Don Byer to us.
All right. Thank you, everybody.
Thank you, everybody.
Thank you.
See you all.
Uh,
Bye-bye.